Hello again. My name is Mitch Sanders. I'm chair of the Wound Healing Society Communications Committee, and it's my pleasure with Kyle Quinn to provide another WHS Fireside Chat series where we take an author from wound repair and regeneration and feature a stellar paper. Today we have Trung Nguyen from Notre Dame. And we're going to talk about his paper, Hyperbaric Oxygen Therapy Accelerates Wound Healing in a Diabetic Mouse by Decreasing the Active Matrix Metalloproteinase 9. So Trung, welcome. Great to see you. Happy holidays.
Hi, Mitch. Thank you for having me, and thank you for the opportunity of speaking on my paper. So that's wonderful. Thank you very much, and happy holiday to you.
Wonderful. And just so you know, Trung was a Wound Shark Innovation winner 2019. And it's great to be following his great work, and he has some other papers coming out this year as well. So why don't we start with the questions, and then we can chat about other things in the end. So the paper really, what I love about your paper is it's really well designed. And when you did the preclinical studies, the diabetic mouse studies, you were smart enough to do the wound healing studies kind of almost separately for a lot of the other biochemistry and biomarker studies that you were doing. And oftentimes I think people don't think through all the experiments that they need to do. And oftentimes they don't have enough power because they just don't have enough samples at the end of the day to do immunohistochemistry or qPCR or what have you. So I really thought it was a very nice design of how you did the studies. So let's jump in and ask some specific questions. So let's start with MMPs and can you how previous studies may have provided misleading results because they may not have been studying the active form of the enzyme.
So Mitch, as you mentioned, MMPs are, I think it's challenging to work with MMPs because MMPs, they exist in 3 different forms. So human body first produced MMPs at pro-MMP with the pro domain blocking the active site. And the active site needs to be removed in order for the enzyme to be activated, right, to be active. And this active MMP version is then regulated by another proteins called TIMs to keep essentially the MMPs in check. So out of 3 forms of MMPs, only the active MMPs are categorically can play roles in the physiology or pathology of diseases. Now, like you mentioned, it's challenging working with MMPs because a lot of techniques right now of profiling MMPs like gelatin zymography or even Western blot, they fail to distinguish the 3 forms of MMPs. Essentially, they fail to recognize the active MMPs. Now, our group here at Notre Dame, we develop an affinity resin. Think of this resin like a fishing hook, right? So the fishing hook, what it does is that it go in and it fish out only the active MMP. And then these active MMPs later on can be identified by proteomics and quantify them as well. So we applied it methodology in the past in the wounds of diabetic mice, like you mentioned, and we found 2 MMPs at play, MMPA and MMP9. And long story short, many years of work. Essentially we came down. We did a really nice systematic research show that MMPA play a repair role, whereas MMP9 is the problem that causing the wounds to delay. And I did the work a couple of years ago where I used the same fishing hook, same proteomics technology that we developed, and we have demonstrated that active MMP9 exists in human diabetic wounds, and the more severe the patient, the wounds are, the more level of MMP9. So that was very interesting when we validate this active MMP9 in the patients.
Sure. So the paper describes the novel result of how hyperbaric oxygen or HPO therapy activates enzymes such as superoxide dismutase, catalase, and glutathione peroxidase, enzymes that overturn the reactive oxygen species. How does their specificity over turning over the ROS specifically to inhibit MMP9 but not MMP8?
That's a good question. So the production of reactive oxygen species or ROS is beneficial, right, to help defend against pathogens when you have a wound. This ROS has also been shown to stimulate the production of MMPs, but this regulation of ROS can be bad because it can hinder the repair process of wound healing. So, upon injury, the cells like neutrophils will come to the injury site and it will produce MMP 8 and 9, as well as ROS to kill bacteria. But the increased level of ROS, like I mentioned, it can increase the level of MMP9 as well, and which we have talked about how it's detrimental or how it's bad for diabetic wound healing. So the hyperbaric oxygen therapy, it actually can lower the level of ROS as we discovered, and it also lower the level of MMP9 in the process. And then on the other hand, MMPA is playing a beneficial role and is not really affected one way or the other by using hyperbaric oxygen therapy. So our best approach would be treating diabetic foot ulcers by providing a selective inhibition to this detrimental MMP9, so that you can, where it can spare the MMPA to go on and do its repair function.
When I think of a diabetic foot ulcer where you have a hyperactivated inflammatory phase, I think of MMP9 from your work, but I also think of human neutrophil elastase. Have you looked at H&E and how it kind of affects the whole process as well? And oftentimes MMP9 and H&E can be hyperactivated by infection as well.
Yep. We have not looked at that. What we have looked at was the level of reactive oxygen species and how it's correlated with MMP9. In a previous paper before the hyperbaric oxygen therapy paper, we demonstrate that the higher level of reactive oxygen species, it leads to a factor called NF-kappa beta. The upregulation of NF-kappa beta would translate to more upregulation of MMP9, which is ultimately detrimental to the wound. But yeah.
Okay, great. As I say, I thought the experiments were really well designed, and obviously you're going after kind of to quell the inflammatory phase to kind of accelerate the proliferation. And so you're only studying the early phase of wound healing. I think you go up to, what, is it day 7 or day 14?
We went up to day 14. So we're essentially monitoring up to day 0, you create the wounds, and then you went all the way to day 14. And then, the early phases where the inflammation happened, we also observed that very closely.
And you utilize a number of really cool technologies like zymography and affinity resins and superoxide dismutase. Can you describe some of the kind of the cool probes that you use? DQ gelatin, DQ collagen, luminol L12?
Absolutely. So the first thing first, when I talk about the luminol base L012 bio, I think it's a luminol base. So what we do is that the wounded mice were treated with hyperbaric oxygen therapy, and the regimen including like 90 minutes of 100% oxygen, right? And after that, we inject the mice with the L012, which is a luminol base, to visualize the level of ROS at the wound sites. We found that the mice that were treated with HBO show a reduction of ROS. So I thought it was pretty cool. As for DQ gelatin and DQ collagens, so these are the wound tissue of the mice that I collect them, and then we cryosection them, and then I incubate them with a fluorescent substrates. In this case, it's a GQ gelatin substrate that help visualize the level of gelatinase. And we have shown that in the wounds, the gelatinase is MMP9. And by the same story go for collagenase, it would be MMP8. So we use these tools based on our previous research to visualize the level of gelatinase and collagenases in the wound tissue. And we show that, it show a reduction of gelatinase.
Do you get spatial resolution as well? So it's like in situ tomography essentially, but can you see certain areas of cells that are more, or the ECM that are more active than others?
I did not look at the spatial, because in this case we only want to look at the level. This is a wound tissue where we look at like you take it apart and then you slice them, and then we look at the whole.
So
where the wound beds are.
Yeah. Okay. Your group has also been working on ND336. Can you explain what it is for the WHS audience and the current status of the I guess it's a drug, not a device, yes?
It's a drug, yeah, with pleasure. I think it's a really cool project. So it's also, obviously, it's been my passion. So our group has shown that active MMP9 is responsible for delaying wound healing in diabetic mice. And we subsequently validated MMP9 as a target by using human diabetic foot ulcer tissues. Now, we also discovered a small molecule called RND336. And this is a selective inhibitor that can shut down the MMP9 activity really well. And because, like you mentioned, MMP has a closely related families, but with RND336, it's only shut down MMP9 activity while sparing the other MMPs. And because of this potency, this molecule shown great efficacy in improving wound healing in diabetic animals, and it even showed better efficacy than Granex. We published a paper this year showing that this drug could be used by itself or in combination with linezolid to improve wound healing in infected model. So that was really cool. That was not a cool paper we published this year. Like you mentioned, this is a drug, and this drug is currently being completed for all the pre-IND enabling studies. And these studies are conducted at Charles River and other CROs. Another CRO is completing the synthesis of the cGMP drug in order to use it for the GLP studies, as well as the anticipated phase 1 clinical trials. So we are pretty excited about this promising drug progress so far. And 2020 hasn't made it any easier, but we weathered through it. I think I think it's going well.
Wonderful. So, I think the work that you do is just stellar, and if we can ever help you, we'd be delighted.
Thank you. Yes.
And, I hope everybody from the Wound Healing Society gets to go back and read this paper. It's just really well designed, and a very thoughtful preclinical design really leads to much better data with better p-values.